Thank you, Amir. I was saying it's my pleasure to present National Digital Health Policy in Latin America and the Caribbean. Next, please. Okay, WHO provides a very nice approach to digital health delivery. It is based in three axes: policymakers who support decision makers at the local, regional, and national level; practitioners who facilitate the capacity to use digital technologies to deliver healthcare benefits effectively; and of course, the population, who is the principal reason of all the efforts from the digital health initiatives. Next, please. The Global Strategy on Digital Health 2020-25, delivered by WHO again, emphasizes on the relevant relationship between digital health initiatives and also the Sustained Development Goals. In this regard, this guideline provides objectives with a specific determination of suggested policies and actions. You can easily be able to understand not just the relevance, but also the guidelines to make happen the changes in the context and the priorities consistent to each country. Next, please. By the side of PAHO, Pan American Health Organization provides 8 principles in the digital transformation. These principles, of course, focus on public health, include also the achievement of universal connectivity. Both WHO and PAHO provides in this regard, in this way, valuable documents who makes able and available to the countries among the world the implementation of digital health solutions. Next, please. Let's go to the implementation of appropriate digital health technologies. In this regard, let's just remind that at LMIC, National Health Strategies has 2 components: global solutions and shared services. Strategic objectives stated by WHO includes the promotion of global collaboration, advance the implementation of national digital health strategies, also the strengthening of governance for digital health at global, regional, and national levels. Finally, advocate people-centered health systems that are enabled by digital health. In the next slide, we're gonna observe that WHO suggests 4 policies options to support, for example, the first strategic goal: promote global collaboration and advance the transfer of knowledge on digital health. In this regard, has the suggestion of 4 digital health policies option. Let's take a look to the first one: co-create the global strategy on digital health and establish mechanisms for strengthening national digital health strategies. I kindly suggest you remind this one on the following slides to see what is going on in LMIC region. Next, please. The Inter-American Development Bank at 2020 provides the digital health regulatory frameworks in the region 2020, which consolidate all the advances at that moment from the several countries of the region. You can easily observe that we can have 3 groups of countries that are making advances in several ways, most of them with a lot of efforts and investment, but of course with a diverse achievement of outputs. The first group is a highly developed regulatory frameworks. Most of these countries have had specific national regulations governing the implementation and use of EHR for several years. The second group No specific regulation on EHR at that moment, important progress on patient data protections, and secondary use of information. The third one, its main regulatory strengths are data protections and patient role in relation to their health data and some other goals. Let's go to the next one, please. Let's take a look to achievements regarding healthcare and social security institutions in the Americas by the use of telemedicine in COVID-19. This is information collected in 2021, and you can see obviously the differences and advances from the beginning and currently in 2020 in Argentina. Next one. Ecuador, Peru, Mexico, Uruguay, and Uruguay as well. You can see through this, the first one, please, the previous one, please. You can see through this diversity, every country is making progresses. The issue is the progress are not having yet the shared standards, are not under a regional agenda. So this is something to be changed in medium and long term. Next one, please. The progress in strategy formulation and infrastructure and connectivity in the region shows clearly in the framework. You can see in the right that clearly 3 countries are making very good progress: Uruguay, Chile, and Colombia. Of course, again, you can observe all the region is working very hard and have some achievements and other goals to be developed. Next. Finally, again, LMIC has diverse advances in digital health, although the shared agenda and the regulatory framework to be developed is so essential to make things sustainable, achievable, but also benefit to the patients. The training is important, and clinical engineers has a lot to do in the progress of this amazing but relevant process. Thank you very much.